everyone, welcome to Logic Medico. Today's interesting topic is Psoas sign. So what is this sign and where do we see this sign? We'll see this. So here is the lumbar vertebral column. Beginning from the anterolateral surface of the lumbar vertebral column is a muscle called Psoas major, which you can see in light brown or orange color. It passes in front of the hip joint to finally attach to the lesser trochanter of the femur. It usually causes flexion of the knee joint. Acting from below, it can also cause flexion of lumbar vertebral column. As you can see, the relation of Psoas major, especially the right Psoas major, is related to the cecum and appendix. So in case of appendicitis, the most common position of appendix is retrocaecal position, the 12 o'clock position. So in case of appendicitis, the inflamed appendix is against the Psoas major. That is the first concept you should understand. So in order to demonstrate Psoas sign, the person is in supine position, that is the back resting on the table and the front of the patient facing upwards, that is supine position. And then we should ask the patient to flex his knee and his hip like this. So this is a supine position, and then we have asked the patient to, so this is supine position, we have asked the patient to flex his knee and his hip. So when we are flexing, when the patient is flexing the hip and the knee, we are offering some resistance here. We are holding our hand here and offering a resistance over here. So while doing so, if the patient gets the pain near the hip region, that is especially the right hip region, it suggests appendicitis. How is that there is an appendicitis? I will tell you. Or we can ask the patient to extend or hyperextend the hip joint. Initially the patient will be in this position, in this case flex that knee and hip. Then we'll ask the patient to hyperextend the hip joint like this. Even here there is a pain in the hip region. So this suggests appendicitis, and this sign is called as Psoas sign. There are few differential diagnoses other than appendicitis. There can be hemorrhage in the iliac vessels. Okay, and also the inflammation of retroperitoneal. So retroperitoneal inflammation and iliac vessels, hemorrhage in the iliac vessels are also the differential diagnosis. But the most common finding is appendicitis. So how there is appendicitis, I will tell you now. Already in the beginning I have told about the relation. So in case of appendicitis, this area of the appendix is inflamed. Okay, inflamed means there is redness, there is swelling, and of course there will be pain. That is the third sign. So this Psoas major, when it contracts, it will move the peritoneum. So when it contracts or when it is stretched, it will contract during flexion of the hip. It will contract during flexion of the hip, and when it is stretched, that is extension of the hip. So when it is stretched, it is extension of the hip. So whenever you do such movement, so the movement of the muscle will cause the tissue to move, the muscular tissue to move across the inflamed peritoneum. This causes the pain in the hip joint. To summarize, Psoas sign. This Psoas sign is also called by other names, which I will write in the description. The Psoas sign is a sign for actually detecting, clinical sign of detecting appendicitis. When we move the Psoas muscle, either by contracting the Psoas muscle or stretching the Psoas muscle, by flexing the hip or extension of the hip, the movement of the Psoas major causes against the inflamed appendix, causes the patient to feel the pain in the hip region, either while flexing the hip against the resistance offered by the doctor or extension of the hip. Diagnosis mainly appendicitis. The other differential diagnosis is retroperitoneal inflammation and bleeding from the iliac vessel, either the common iliac vessels or the external iliac vessels can also be the possibility. And there can also be a psoas abscess, that is pus collecting underneath the psoas major, especially during tuberculosis. Thank you for watching and learning from Logic Medico. Kindly press the thumbs up icon and share this video with your friends, and if you're new to our channel, kindly consider subscribing. Thank you once again for coming to Logic Medico.